You ever notice how today's news feels like ancient history by tomorrow? But then some stories, you can't just shake off those stories with layers. That's what we're diving into today in Mpox. Well, specifically, that second PHEIC declaration. We're going beyond the headlines, trying to really get at why another declaration was necessary. You know what's different this time around. Our guide for this deep dive is really fascinating. It's a manuscript from this Dr. Aileen M. Marty and her team. And it's currently being reviewed for publication in a well-respected scientific journal, which really adds, I think, to its credibility. Let me tell you, it's just jam-packed with insights that I think really illuminate this outbreak in a new way.
Yeah.
Because it's not just a repeat of 2022, is it? We're dealing with multiple Mpox clades in circulation now.
And they really are distinct. Think of them almost like different flavors of the virus, each with its own quirks, I guess you could say. How it spreads, how severe it is, even how we diagnose it. It's like Mpox went to some viral training camp and really leveled up its game. So to really kick things off, I think we need to break down these different clades. We've got clade II, and I, kind of like well, I was going to say a boy band, but instead of catchy tunes, they're bringing us unique challenges.
And what's so fascinating is that understanding these clades is so crucial. And they didn't even differentiate them initially. Early Mpox research, it was like they were trying to write a novel in the dark. The tools to do this, to sequence and really understand the viral genome, they were expensive and not as advanced as we have today.
So something so crucial to the virus's behavior was basically hidden in plain sight. So what finally brought these clades into focus?
I think the threat of bioterrorism, if you can believe it, in the early 2000s, that really pushed scientists and researchers to finally crack that code, that Mpox genome code. And suddenly the spotlight was on this virus, and that's when they discovered that it wasn't this single entity, but rather this family with these distinct branches. And each branch had its own story to tell.
Okay, so let's meet the branches, these clades. Let's start with the original, I guess, Cladia. What's its claim to fame?
Cladia, it's the OG, right? Like the one that started it all. This is the one responsible for that first human case back in 1970 in the Democratic Republic of Congo. And since then, it's been mainly circulating in Central Africa, primarily spread through very close contact.
And we're talking about a virus with a little bit of a reputation, right?
Yeah, unfortunately, Cladia has a higher mortality rate compared to some of the others. It can range from like 5 to 10%. So it's a stark reminder that Mpox is not something to be, taken lightly.
And to be clear, are we mainly just focusing on human-to-human transmission in this deep dive?
Yeah, that's right. I mean, while Mpox is zoonotic, meaning it can jump from animals to humans, we're really focusing on how these different clades are impacting us directly, human to human.
Got it. So we've got Clade Ia, the original, primarily Central Africa, spread through close contact, and with that higher chance of, well, serious complications. What about this newcomer, this Clade Ib? What's the deal with that one?
So this is where it gets really interesting. Clade Ib is like the new kid on the block. It was just discovered this year, 2024, and it's already raising some eyebrows.
Why? What makes it different from Ia?
So like Aya, it's, primarily found in Central Africa, but here's the catch. It's showing signs of being more easily transmissible between people, especially through sexual contact. And there have already been cases of IB identified in travelers to Sweden and Thailand just recently.
So it's on the move.
Mm.
That definitely highlights how interconnected we all are globally.
Absolutely. It really does. And it really underscores how important it is that we understand how these different clades, how they act, so we can stay ahead of these potential outbreaks.
Okay, so a little unsettling, but good information to have. We've covered the I clades, Aya, the OG, with that higher mortality rate, and I, the newcomer, with that knack for, well, spreading more easily between us. Let's move on to the I clades, starting with Clade Saya. What's its story?
Clade Saya is fascinating because it prefers to, it hangs out in animal populations, really. It's what we call a zoonotic clade. It only occasionally makes the jump to us humans.
So it's like the introvert of the group, happy in its own circle.
Oh, yeah, you could say that. Interestingly, though, that very first Mpox virus ever identified, way back in 1958, was a Clade Phi strain, found in a group of monkeys, actually.
So it's been lurking in the background for decades. Has it caused any significant human outbreaks during that time?
Not really, no. Clade Phi is generally considered milder than its Clade I cousins. We haven't actually seen any deaths linked to it.
That's somewhat reassuring, I guess. So that brings us to the final member of our little viral supergroup here, Clade I. But this is the one that grabbed all the headlines in 2022, correct?
That's the one. Clade is, well, it's kind of like a shapeshifter. It's the one that's shown the most adaptability when it comes to spreading among us humans. While it also originated in animal populations, it's undergone these significant mutations that make it, well, far more effective at human-to-human transmission, mainly through sexual contact, as we saw during the 2022 outbreak.
And if I remember correctly, there's this fascinating link between our own immune system and the evolution of these B clades, both IB and IB. Something to do with ApoBec3 enzymes,
So
right?
you've done your homework, absolutely. This is where things get really, really intriguing. Our cells have these fascinating defense mechanisms called ApoBec3 enzymes. Essentially, they're like our own internal virus fighters. What they do is target the virus's genetic code, almost like scrambling their instructions to stop them from replicating.
So our bodies have this built-in antivirus system. That's amazing. But how does that actually help the B clades of Mpox to evolve?
Well, it's a bit ironic, actually. In the case of IB and IB, these ApoBec3 enzymes are actually inadvertently aiding the virus's evolution.
Hold on, really? How does that work? I'm not following.
Okay, think of it like this. Imagine you're trying to fix a leaky faucet, but the wrench you're using is slightly the wrong size. You might temporarily stop that leak, but you also might loosen other pipes in the process, right?
Okay, yeah, I can see that happening.
So in trying to fight off the virus, the ApoBec3 enzymes sometimes drive mutations in these B clades, and in some instances, those mutations accidentally make the virus even better at spreading between people.
Wow. It's like our bodies are accidentally helping the virus become stronger. It's like our defenses are backfiring.
Yeah, that's a great way to put it. It's this constant back and forth and evolutionary arms race, and we see this very clearly with clade IB, the one responsible for that big 2023 outbreak. That clade has become very good at spreading from person to person, and it's partly because of this unintentional help from our own immune systems. It just goes to show that we're not dealing with some static enemy here. This virus is dynamic, it's constantly evolving, changing.
Dynamic is definitely one word for it. So we've got these different clades, each with its own characteristics, its way of spreading. And we're a part of this. Our actions can actually influence how the virus evolves. It's all interconnected, isn't it?
It is, and that's exactly where the concept of One Health comes in. It acknowledges this interconnectedness, how human health, animal health, and environmental health are all intertwined.
I've heard that term before. One Health. But I have to admit, I'm a little fuzzy on the details. How would you explain it, especially in the context of Mpox?
Okay, well, think about it this way. As we humans continue to expand further into forests and wildlife habitats, we inevitably increase our chances of encountering animals that carry viruses, including Mpox. Deforestation, urbanization, climate change, these all contribute to more contact, closer contact, between people and animals. And that makes those spillover events, where a virus jumps from an animal to a human, much more likely.
So it's not just bad luck or some random occurrence. It's a direct consequence of our actions.
Exactly. And every time a virus spills over from an animal to a human, it's like rolling the dice. The virus might mutate and become better suited to spreading among us, or worse, it might become more deadly.
That's a pretty sobering thought. It's not just about us getting unlucky. It's about understanding the impact of our actions on a much larger scale.
Absolutely. Mpox is just one example of this. The One Health concept stresses that to truly protect ourselves from zoonotic diseases like Mpox, we need to think bigger, more holistically. Protecting ourselves means protecting the health of the planet as a whole.
Okay, so we've covered a lot of ground here. Different Mpox clades, how they spread, how our actions can actually influence their evolution. And you've explained the One Health concept really well. But let's get practical for a moment. What if someone listening or someone they know thinks they might have Mpox? With these different clades circulating now, what's the best course of action? What should they do?
Well, first and foremost, if you have any concerns, you need to seek medical attention right away. Don't try to diagnose yourself or treat yourself at home. Early intervention is absolutely key. Be sure to tell your doctor about any recent travel, especially if you've been to an area with known Mpox cases.
And since we now know that transmission isn't limited to just contact with infected animals, it's important to be upfront about any potential exposure through close contact or sexual contact too, right?
Absolutely. Being honest with your healthcare provider is crucial, not just for getting the right diagnosis, but also for preventing the virus from spreading further.
So step one,
Okay.
talk to a doctor. What happens next? How do healthcare professionals actually figure out which clade is causing the infection? How do they even begin to narrow it down?
That's where things can get a bit tricky. We do have those reliable tests, like the PCR test, which can definitely tell us if someone has Mpox. However, those tests don't always tell us the specific clade that's causing the infection.
So it's like knowing there's a fire, but not knowing what kind of fuel is feeding it.
Mm-hmm.
Makes it much harder to put it out effectively, right?
That's a great analogy. To really pinpoint the specific clade, we often need more specialized testing, like genomic sequencing.
Yeah.
And unfortunately, those specialized tests, like genomic sequencing, aren't as readily available as a standard PCR test, especially in certain areas.
I was going to say, that doesn't sound like a test you can just get at any clinic.
Exactly. Access can be limited, which can definitely complicate things when you're trying to control an outbreak. The good news is that scientists are hard at work trying to develop those faster, more accessible tests. We need tests that can give us that specific clade identification quickly and easily.
That's reassuring to hear. But for now, we have to work with what we have. And knowing the specific clade, I imagine, is crucial for determining the most effective course of treatment, right?
Absolutely. Treatment plans often hinge on both the specific clade we're dealing with and the severity of the infection. Now, for many, particularly those who have milder cases caused by clade IBID, supportive care is often enough.
So basically helping the body fight off the virus naturally with a little extra support. What does that involve?
Exactly. Think rest, fluids, pain management, all those essential things that bring comfort and help the body focus on healing. And of course, we closely monitor for any signs of secondary infections just to be safe.
So good old-fashioned TLC. But what about those more serious cases, or if it's one of the more aggressive clades like IA or AB, what happens then? Are there more proactive treatment options?
In those situations, yes, we do have antiviral medications that have proven to be effective in treating Mpox.
Good to know we have those tools available. And what's the latest on the vaccine front? Any new developments there?
We're fortunate that the smallpox vaccines we already have, such as ACAM2000 and JYNEOS, also provide protection against Mpox.
So it's like a 2-for-1 deal. One vaccine, multiple clades covered.
That's a great way to put it. Although it's important to remember that vaccine efficacy can vary depending on the specific clade we're dealing with, as well as individual factors like immune system strength. But they are definitely a crucial part of our strategy for preventing and controlling outbreaks.
It sounds like there's still a lot to learn about how effective these vaccines are against all the different clades. It's not as simple as saying, get vaccinated and you're good to go.
You're exactly right. And that's where research is so important, right? We need ongoing research to fine-tune our vaccination strategies, especially with this virus constantly evolving.
And speaking of staying ahead of this virus, I think that's where the work of Dr. Marty and her team is so important. You mentioned their updated Mpox Identify, Isolate, Inform tool, the 3I tool at the end of the last part. Could you unpack that for our listeners? What exactly is this 3I tool and how could it help?
Imagine you're a healthcare professional, right? You're in a busy clinic or maybe an emergency room. A patient comes in with a fever, a rash, could be anything. The 3I tool is like having a roadmap. It helps guide healthcare professionals through those initial stages of a potential Mpox case. It ensures they're asking the right questions and following the proper protocols.
So like a step-by-step guide to help with early identification and management.
Exactly. It helps ensure nothing is missed, which is so crucial in those early stages when every moment counts.
Okay, I'm definitely getting curious about this 3I tool. Walk us through how it works. What are the steps involved?
Sure. The first I stands for identify. It all comes down to recognizing those early warning signs, those red flags that might suggest Mpox. Has the patient recently traveled to an area with known cases? Have they been in close contact with someone who might have Mpox? And here's where this updated tool is really helpful. It prompts healthcare providers to ask about potential exposure through sexual contact as well.
That's important because, as we've discussed, those old assumptions about transmission just don't always apply anymore.
Absolutely. This new version of the 3I tool really reflects our current understanding of Mpox, including those changing transmission dynamics we talked about earlier.
So we've identified potential risk factors. What's the next I?
The next one is isolate.
Makes sense. Even if you're not 100% sure it's Mpox, better to be safe than sorry.
Exactly. Rapid isolation is one of the most effective ways to prevent a larger outbreak. So the 3I tool emphasizes the importance of using the correct personal protective equipment, that's PPE, and taking steps to minimize contact with other patients and staff until a diagnosis is confirmed.
All those infection control procedures we're all familiar with these days.
Yeah.
Okay, so we've identified potential risk factors, we've isolated the individual. What's the final I?
The final I stands for inform.
So it's time to loop in the authorities, right?
Exactly. Quickly informing the appropriate public health authorities is essential. It allows them to initiate contact tracing if needed implement any necessary preventative measures in the community, and hopefully contain the outbreak before it has a chance to spread further.
It's incredible how something as straightforward as this tool can have such a big impact on public health.